right, so we're gonna go over accessing ports, central line access devices. So this patient has a port. You can feel it here, okay? The patients are very knowledgeable because they've had an access before, so you always want to ask them what size needle did they use, do they need numbing medicine? Most of the time they don't need anything because they're just so used to being accessed. There's a competency for this, so this is an advanced competency. It's not something that everybody does, but you have to do some to be checked off. So there's supplies for it. One, you need a mask, and the patient needs a mask, and there's a mask in the kit. This kit is above pre-op, up by the IV catheters, up above, and there's a couple things you need to get. So this kit has Tegaderm with chlorhexidine attached to it, gauze. There is a connector, so like one of these little connectors. There's a pen for marking. There's syringes if you need to pull any labs while you're doing it, and you also want to check for blood return, so you got to have that. Skin protectant swab, so you can prep the skin before you put the dressing on. Chlor prep to wash the skin. Hand sanitizer. There's gloves, sterile gloves, and a mask, so you give the patient the mask. There's no saline syringes in this, so you have to have a sterile saline syringe. So this is not like our regular flushes. So there are sterile wrapped saline syringes up with this kit. There's also Huber needles. Huber needles are, I'm going to open this up, but there's different sizes. There's a 20 gauge, and I believe there's like a 19, maybe 21 gauge. And some of them are 1 inch, some of them are less than that. The patient will know what size they use, okay? I'm gonna open this up. Now this is be opened up sterilely, okay? But I'm gonna show you what the Huber needle looks like, okay? Because it's very unusual. It's got its own little, okay. All right, so this is what they look like. You see how they have these ports? There, when you go to draw on things, these are okay, but it's best to have a port that you can access from easily. So you want to get one of these needleless ports to put here, and then I usually put one on this end too, and then I hook my fluids to that. Okay, that way you can unhook your fluids and not have it, flipping around if you want to get your patient up and about. But you always want to have a couple of these. So I got an extra one, and there's one in the kit. Huber needles go straight down, okay? And there's a little clamp, okay? There's a clamp there, a clamp here. And these are pretty little sharp things, but they work really, really well. When you go to put it in, let's talk about prepping first, okay? We're gonna open this kit and you can see what it looks like, okay? So you do your hand hygiene, make sure everything's clean. You have your patient masked, you put a mask on, because this is a sterile process, okay? We're gonna open this up, and there's hand hygiene stuff, woohoo, and a mask. So here's your patient's mask, okay? And actually one for you too, but I like ours better. There's hand hygiene, so you can wash your hands. Okay, I wash my hands. There's sterile gloves, okay? And then here's the kit. So it's got everything in there, except for the saline and another one of those ports in the needle, okay? So what I'm going to do is I'm going to pop this syringe of saline on there. My little port's going to go on there because I always like to have an extra. Okay, it's good to have two there. And then this little needle is going to go on there too. Okay, so everything's been sterile. Okay, we're going to grab our gloves. And of course, we're going to tell our patient what we're doing. Put our gloves on. These pretty purple ones. These are thick gloves. Okay. All right. So your patient's here. What I usually do is I will prep this needle with a little saline. Okay. That's what I usually do. okay? And then the other thing I do, I have, see how there's, oh, there actually are 2 in here. I didn't think there were 2. Awesome. The other thing I do is I will take this port and usually I will get the air out of it, and I'll make sure this is where I'm going to pull back for blood, okay? Because it's closer to the patient, and then I can flush it easier, okay? And don't need that because we're not going to mark them, okay? There's a Hibiclens. This is the skin protectant, okay? The first we're going to do is wash them off with Hibiclens, okay? So this is my dirty hand because I'm going to be doing this, okay? Making sure our patient stays still. Just the port. Okay. Now, once you do Hibiclens, you have to have it dry for 30 seconds, okay? So we have to wait for it to dry. Okay, so once it's dry, you're going to take this little port. You see how the needle's kind of different? It's kind of weird, isn't it? So this goes straight down. So you're going to look, you're going to feel for where the port is. And this person's skinny, so it's easier to find. But you're going to go right straight down the middle, okay? And what you're going to do is you're going to hit, it's going to hit the back, okay? And so it may not look like it goes all the way in. This might be a little bit deep for them, like a little bit long. But you're not going to be able to go any farther. It's the back of the port, okay? And that's how you know you're done popping that in there. Once you're in there, you need to be sure that there is blood return, okay? I've had a patient that hadn't accessed theirs in 3 months, and it was clotted off. So you can access it, but if you don't have blood return, you cannot use it, okay? You have to let anesthesia know, whoever wants us to access the port, okay? So you're going to pull back. I'm going to clamp that one. I'm going to pull back, and we should get blood return, okay? Because we don't, this is a mannequin, we're not going to get blood return, but you should have a good blood return. If you don't, you can't use it, okay? And you got to de-access, because sometimes the patients will say, hey, you know, I have to turn a particular way for them to get blood. I'm like, okay, turn that a little bit away and see. Sometimes it's picky for patients. But if they haven't, you know, if you can't get one, you can't use it. So once you've pulled back, I usually, if this is the time to do blood draws, if you're going to do blood draws, okay? So if you have a particular lab, you would pull it back now, okay? And then I put my little ports on, okay? Because you want your port on. Nice flat port, okay? And then what you're going to do is you're going to just make sure it flushes well, okay? And then you're going to put your port on this one, okay? Oh, actually, I like to use theirs. Doesn't have an end on it, I can take off. Okay, now you're going to prep their skin. So there's the skin prep. So you're going to skin prep them, okay? So make sure that that doesn't bother their skin when you put all this Tegaderm on them, okay? Okay. All right, so this is the little Tegaderm, 3M Tegaderm. It's kind of just a weird little dressing. But this one goes around the port.
And that's the one infused with
This is the one infused with chlorhexidine, okay? So it's just a weird little device, okay? So you put it up and around the port, like this, okay? And then all the tape comes off. Hopefully, because I have a little, this is just hard to do with stickies. Okay. And then you're going to put this other one over everything, okay? Now, when you are putting this on and you get it all attached, just know whoever's accessing this port, they need to put the order in for heparin. Once this is accessed and you want to de-access it, it has to be heparinized for them not to be clotted off, okay? So what you're going to do is you're going to, there's an order, there's a sub-plan in anesthesia for heparin, and it's a 5,000 units of heparin IV into this. So what you're going to do is when you de-access it, Of course, you're gonna be masked just like you are now, okay? I would use clean gloves and then sterile gloves. I use sterile gloves when I take that thing out, just because it's accessing a major device. When you take it off, you're going to flush it first, make sure all your meds are out of it, okay? And then you're gonna put your 5,000 units in it, and then you're gonna just de-access it, okay? I think anything else. Documentation wise, you need to use BCMA for any of your meds, including the fluids that go in and the heparin, okay? And then other things with the port, I'm trying to think if there's anything else. Make sure there's anything else. De-accessing we went through. Most people don't need an anesthetic, we talked about that. Documenting it, it's in our eye view with central lines. There's a central line spot, okay? Tubes and wounds, you can put it under that, okay?